Okay, good morning. So it's Dr. Cedric here again. So we are here for our weekly sports medicine CME lah. Today I'll be presenting on a topic that's called Osgood Schlatter disease. It's quite common among adolescent active athletes and normally seen in sports that require a lot of jumping and also movements lah. So we start from definition. Osgood Schlatter disease, also known as osteochondrosis, tibial tubercle apophysitis, traction apophysitis of tibial tubercle, and is a common cause of anterior knee pain in skeletally immature athletic population. For classification-wise, there isn't a universally accepted classification system, but commonly it is divided into stages based on clinical and radiographic criteria, or there's a modified classification system which includes the both. So I will talk about the modified classification system. It integrates both clinical and also radiographic findings for a more comprehensive approach. So type 1 is the early stage. Clinically, there will be mild pain and tenderness after activity. And for the radiographic wise, there will be normal or slight soft tissue swelling seen. And for type 2, it's a progressive stage. Clinically, the patient complain of moderate pain during and after activity, and visible swelling will be noted. For radiographic wise, ossicle formation can be seen and there's increased soft tissue swelling. And for type 3 is a chronic stage where clinically patient will have severe constant pain, significant swelling, and also there's functional impairment involved. And radiographic wise, there's a pronounced ossification and fragmentation, possible residual deformity seen. Okay, for pathophysiology, there are a few key factors we need to take note for Osgood Schlatter disease. So the first is the growth spurts and bone development during puberty. So during puberty, bone grows rapidly. Growth plates, the epiphyseal plates, they are more susceptible to injuries during this stage. So the tibial tuberosity, where the patella tendon attaches and the growth plate remains cartilaginous, and that's how it can lead to Osgood Schlatter disease. Next, we all need to take note also there will be a lot of repetitive stress and also microtrauma that cause to this Osgood Schlatter disease. Inflammation and pain, bone remodeling and also ossicle formation, and factors such as biomechanical and also structural factors. So there will be some individuals that have different variation in the biomechanics. Some may have tighter quads, some may have better hamstring flexibility, some may not, and also the valgus and varus form of variations of the knee can lead to these two. Okay, so for the pathophysiological sequence, in the initial stage during growth spurt, there will be increased mechanical loading from activities resulting in repetitive microtrauma to the tibial tuberosity. Then comes the inflammatory response, where the microtrauma induces inflammatory response, causing pain and swelling. Okay, so the patellar tendon and the surrounding tissue become inflamed. Then next come the repair and remodeling. This is when the body attempts to heal the microtrauma through bone remodeling, leading to ossicle formation. Okay, and then the chronic stage. Okay, so for risk factors, what are the risk factors? Okay, number 1 is age. For adolescents, for girls, they are normally aged 8 to 13 years old, more prone to getting OSD. And for boys, aged 10 to 15. Gender-wise, boys tend to get more than girls due to high participation of activity in sports and physical activities. However, nowadays, girls are also becoming more active and the statistics are becoming more balanced. So next is also physical activity. High impact sports and also a high volume training intensity may lead to OSD, and growth factors can be the next cause of it. And like what I mentioned earlier, biomechanical factors and anatomical factors. Previous knee injury can also cause OSD, and overuse and training errors without proper guidance may also lead to OSD. So clinical manifestation, okay, there'll be pain, either localized to tibial tuberosity or activity-related pain. There will be also swelling, and also if the progression is worse, there will be functional limitation. Patient may also complain of kneeling pain. Clinical examination-wise is quite straightforward. On inspection-wise, we may see this enlarged tibial tubercle associated with swelling, And on palpation, there will be tenderness on palpation on the tuberosity. Okay. And the pain may also be elicited when quads muscle are contracted against resistance. There are no special tests towards this. For assessment and imaging, it's quite straightforward too. We do an X-ray. On the lateral view, we can see irregularity, fragmentation, and tubercle. And if chronic, we can see presence of ossicles in more advanced cases. So for treatment-wise, we primarily focus on pain relieving, reducing the inflammation and swelling of the affected area, and allowing the patient to heal. So most cases, they respond well to conservative management, and surgical intervention is rarely required. Okay, so here's a comprehensive overview of the treatment of Osgood Schlatter disease. So it is further divided into conservative treatment, advanced treatment, and also surgical treatment. For conservative, first, yes, we advise patient for activity modification. So what is it? We ask patient to rest and modify the exercise to low impact exercises. Next come the management, ice compression and adequate NSAIDs as per tolerated. Okay. Third, physical therapy. We will prescribe a lot of stretching of the quads muscle, hamstring muscles, and also strengthening of the quads and hamstring muscles, and educate some range of motion exercises for the patient. Okay. Fourth, we can also teach some protective measures for the patient. For example, if the patient can afford to buy patellar tendon strap, then yes, they may proceed to buy patellar tendon straps and use it. Otherwise, we can teach patient to use zinc oxide taping before activity to prevent this from happening. However, this is not certain that it will help. Okay, we can also educate patient about their condition and also do a frequent monitoring to follow the progression. And in severe cases, we can cast and immobilize for about 6 weeks. Okay, but the complication that may arise from this, we need to take note, is quadriceps wasting. Okay, so for prognosis, we must take note that Osgood Schlatter disease is a self-limiting condition, and it usually resolves with completion of a Dawson growth spurt. And for the long-term outlook, most individuals recover fully with conservative treatment. Okay, for prevention and recurrence of it, we advise patients for gradual increase in the activity, proper warm-up and cooling down, and a balanced and supervised training exercises. That's all from me for Osgood Schlatter disease. Thank you very much.